Hey guys, Dr. Travis Owens with thecheerdoc.com, and today I want to talk to you guys about some common conditions that happen with cheerleaders, gymnasts, with all athletes really, when it comes to pain in the front of the knee. Now, depending on what age you are, there are a couple of different conditions that can happen that can cause pain in the front of the knee. One common one is called Osgood-Schlatter disease. Another is called Sinding-Larsen-Johansson disease. And some of them are simply called patellar tendonitis or jumper's knee. So today I want to talk about how we can address some of these pains that we have in the front of our knee. Actually, I suffered with knee pain in this exact area for about 6 or 7 years. It actually plagued me through my entire cheer career from high school all the way through to when I was done cheering in college. And so this particular pain that people experience is something that I know firsthand. So it's one thing that I want to help prevent in as many athletes as possible, or help as many athletes as I can that may be suffering with this. Now, one of the common things that can cause pain in the front of the knee is tightness or quad dominance. So the muscles in the front of our thigh are called our quads, and when these muscles get overused or they become too tight, it can pull on the front of the knee, which is where it attaches, and can actually cause pain here. Now, one of the easiest ways that we can reduce that is by using our foam roller on a regular basis to ensure that our quads are not too tight, or that we don't have knots, or that we don't become quad dominant. So today I want to show you how to use your foam roller to roll through the front of your thigh to prevent or maybe help with front of the knee pain or anterior knee pain. So what we're going to do is we're going to use our foam roller. We're going to start with the foam roller directly in front or above our knee. Now, we don't want to roll directly on our knee. We want to stay off of the joint. And our goal is going to be to roll from above the knee up to the hip crease, okay? Now, again, avoiding bone. We don't want to get on anything that causes high levels of pain. We also don't want to get on anything that may cause numbness or tingling. So if you feel anything like that, make sure we stay off that point. So what we're going to do is we're going to start on our foam roller right above our knee, and we're going to lay down on top of the roller. Now from here, we're going to roll slowly up and down our leg, and what we're doing is we're hunting or searching for areas that feel tight or uncomfortable. Now if we find that point, we want to stop and we want to hold there. Now we can stay and just let the pressure from the roller, from being on the roller, start to alleviate or reduce this tightness. We can do some small little oscillations or passes back and forth, or we can pin that spot down and we can move our leg. So the goal is we want to reduce the amount of tightness that we have in that area. Some people it may take 30 seconds, some people 60, some people 90, some people up to 2 minutes on one spot before it will finally release. And what we want to do is we want to hunt through all of our quads or our thighs. Now, when we're doing our passes on the roller, we want to make sure that we're hitting all parts of our thighs. We want to hit the inside, we want to hit the top, and we want to hit the outside, okay? So make sure that as you're rolling, that you're stopping with our toes out. We're also going with our toes straight down, and we're making sure to get the side of our thigh to address any of the muscles that may be tight out there. If you're having pain in the front of your knee, give this a shot. It can definitely help to reduce some of the tightness in your quad, which can translate to less pain in the front of your knee.